Hey, you guys, happy Wednesday. You know, on Wednesdays, it is Working Out Wednesday in the nursing studio. So we take this time out to work out practice questions, right? So this week we have been discussing GERD and the changes in treatment options and how to apply this on boards as well as in practice. So let's get into a couple of questions just to kind of test your knowledge, okay? First question states, a patient presents to the office with complaints of a burning sensation to his chest and belching. He states that he wants some relief. Based on the listed responses, which shows the nurse practitioner's understanding of treatment options? A. Do not worry, this will resolve in a few days. B. Let's begin by making a few adjustments of eating six small meals a day. Limit or avoid acidic foods, avoid restrictive clothing, and over-the-counter meds as needed, such as antacids and H2 antagonists can provide some relief. C, come back in 1 week and we can then start medication therapy. Or D, this is probably just gas. No need to worry. All right, I'll give you a second and you tell me what you think. All right, you guys, I always tell you to read the stem of the question first so that you are ensuring that you are answering what they're even asking you. So this stem states, based on the listed responses, which shows the nurse practitioner understanding of the treatment options. All right, so A, don't worry, this will resolve in a few days. Based on the symptoms in the scenario, it's sounding like heartburn. Correct. So we don't know that it'll resolve in a few days. When we think about therapeutic communication for patients, we don't tell them, don't worry. So you can also eliminate D because it says this is probably just gas, no need to worry. That we don't do that. Those over reassuring words in healthcare because we don't know, and then come back in 1 week and then we can start medication therapy. But what is that? What is that solving? What happens in 1 week? So, of course, B here is the best answer because one, you do want to start with lifestyle modifications before really getting into prescribing anything. So those lifestyle modifications as limiting those acidic foods, avoiding them as much as possible, those caffeinated drink items, chocolate, peppermint, things of that nature. Also, going down to 6 smaller meals, so going down the size of the meals because of the bloating and the irritation. So making it easier to digest, coming down to about 6 small meals a day versus 3 large meals a day. And then also they can get over-the-counter meds like your antacids and your H2 antagonists over the counter to take as needed. The antacids like your Rolaids, your Tums, your Mylantas, and they really work much quicker. So a lot of patients really like that because they get that quick and instant relief. Whereas those H2 antagonists like your Pepsids and things of that nature, you can utilize those. Those H2 antagonists may not cause the rapid relief as an antacid will, but it provides, I should say, a longer span of relief. All right, next question. Mr. Smith returns to the office today for follow-up post-EGD. The EGD showed the EGD shows esophagitis, and he was diagnosed with GERD. What will be the best medication for the nurse practitioner to initiate? A, antacids. B, H2 antagonist. C, nothing at this time. Or D, a proton pump inhibitor. All right, I'll give you a second to answer those. Tell me what you think. Get in the comments, please. All right, again, reading the stem of the question first. What would be the best medication for the nurse practitioner to initiate? So, antacids, that's not really something that we are prescribing or initiating. Remembering those keywords, initiate is telling you what's the first thing, and it also says best. So you're going for prioritization, right? So lifestyle modifications and those PRN meds, that's one that they can do. Antacids are over the counter, right? So that's not really where we are when they have that diagnosis of GERD. They can use those PRN as needed, but for the best and the thing that we are initiating, that is what you do with your lifestyle modifications, and you can provide, like we discussed in question number 1. B, H2 antagonist, I'll hold that there. C, nothing at this time. Well, they have a diagnosis of esophagitis and GERD, so we do need to do something, so we can eliminate C as well. And then D, proton pump inhibitor. So B and D, this is the conflicting thing that we have come due to the fairly recent, past couple of years, changes in the ACG guidelines for GERD management. And here, the best answer choice is D, proton pump inhibitors. Originally, H2 antagonist was always our first line therapy, but we have moved with the guidelines as your proton pump inhibitor being the best thing to initiate. One, it works to heal esophagitis, as well as it helps those treatments symptomatically. So it has superiority in that factor because it's not just used to treat the symptom, but we're healing the root cause as well. So that's why we have moved to that to be first line therapy. Again, antacids, H2 antagonists over the counter are great for PRN basis, but for initiating therapy, when you're doing that, when you're moving to prescribe the first medicine, proton pump inhibitors best when you have a diagnosis of GERD, esophagitis. Also, just considering the fact that it is a healing source. But typically now the guidelines are telling you to do like an 8-week trial period and see how the patient's symptoms improve with those proton pump inhibitors. Okay. All right, you guys, as always, like, comment, subscribe, and share with a colleague or friend that may find this helpful as well. And meet me back here next week for some more Work It Out Wednesday questions. Bye, y'all.